Hello, I'm Dr. Collins, and in this clinical examination video, we will explore an important clinical sign used to assess hip abductor weakness, known as Trendelenburg sign. In order to understand the Trendelenburg sign, let's start with a brief anatomy recap. The primary hip abductor muscles are the gluteus medius and gluteus minimus. These muscles are located on the lateral aspect of the pelvis, and they play a crucial role in stabilizing the pelvis during walking and single leg standing. Both muscles are supplied by the superior gluteal nerve. When functioning normally, contraction of the gluteus medius and gluteus minimus on the weight-bearing side keep the pelvis level. However, if these muscles become weak, damaged, or denervated, they're unlikely to adequately stabilize the pelvis, and the pelvis ends up dropping to the contralateral side, in other words, to the opposite side or where the hip abductor weakness is. This can occur for a variety of reasons, such as injury to the superior gluteal nerve, hip surgery, hip dislocation, fractures around the hip, or even prolonged inactivity or a sedentary lifestyle leading to muscle atrophy. In order to elicit the Trendelenburg sign, ask the patient to stand upright. Then ask them to lift one foot off the ground so that they're standing on a single leg. If the patient is experiencing balance issues, a wall may be utilized to assist the patient. Once the patient is on one leg, observe the position of their pelvis carefully. If there is no hip abductor weakness, pelvis should remain level or rise slightly on the side of the lifted leg. A positive Trendelenburg sign occurs when the pelvis drops on the side of the lifted leg. This indicates weakness of the hip abductor muscles, the gluteus medius and gluteus minimus, on the weight-bearing side. Before we close, a quick word on the clinical value of this sign. The Trendelenburg sign has moderate clinical value, with a reported clinical sensitivity of approximately 73% and a specificity of approximately 77%. So while it's by no means a perfect diagnostic sign, it remains a useful clinical examination finding that can help identify hip abductor weakness and guide further assessment. Thanks for watching. If you like this video, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical examination videos on our channel. Good luck!